My name is Kirsten Bibbins Domingo, and I'm co-chair of the Roundtable. I am professor of medicine and epidemiology at the University of California, San Francisco, which is where I am today. Before beginning, I would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. I pay my respects to the Ramaytush Ohlone elders, past, present, and future, who call the land that UCSF sits upon their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. We are a roundtable devoted to sponsoring workshops on population health, and we have just finished a rich, riveting, and deeply nuanced discussion of spatial justice. I would like to thank our organizers, speakers, moderators, staff, and audience for helping to develop the themes that are so important to our discussion of population health. We have learned about our history and why history is not just a series of events, but rather entrenched and reinforcing structures that include serial displacement, rupture, and dispossession of many marginalized communities. We cannot dissociate events from these structures, and we need to make these visible to engage in spatial justice. Repairing these inequities requires an arc of healing, not just managing one event to another. We were challenged by our speakers not just to applaud the building of new houses to address homelessness, but to ask, where are these houses being built? Who is building? Who can access? Because bricks and mortar do not a thriving community make. Our speakers asked us to avoid conventional wisdoms and narratives and easy solutions. And in the context of the cycle of injustice, asked us to challenge ourselves against the even seemingly sustainable solutions that themselves lead to displacement and dispossessions. When bike racks are used to displace those living in an area, there is a problem. Our speakers urged us to consider solutions that include reconnection of people to the land, whether among youth offenders in Hawaii or street vendors in LA, and even for those who might feel even more disconnected from their indigenous lands. Our speakers urge us to embrace and sustain solutions over the long term that will require effective, high-level, and systemic approaches that acknowledge the past and ongoing inequities and have clear rationale, benefits, and accountability. We at the Roundtable are focused on health, and throughout the workshop, we have seen the clear connection of spatial injustice to population health and the deep inequities in health. Our speakers reminded us that the threats and consequences for health from serial forced displacement is real and imminent. Whether we are talking about the impacts and ongoing realities of the global pandemic, the impending lifting of the eviction moratorium, or the latest manifestations of the climate crises in heat, fire, and water events, and who suffers, who dies, who is displaced. The urgency of these crises and the clear indication of the deep inequities in our responses requires that we recommit and center on the principles that all individuals have the right to be protected from climate-induced events, that we shift the burden during these crises away from individuals to systemic processes, organizational policies, and management practices that are deliberate in their focus to increase impacts on historically marginalized communities. And that we adopt a public health model of prevention as the preferred strategy to eliminate threats before they occur. Our conversations have been interdisciplinary, and we have benefited from the extraordinarily rich cross-sector discussions. It is clear that the solutions and the implications for health will require the same type of interdisciplinary discussions and cross-sector collaborations. Many types of professions and knowledge will be required. Joint advocacy is necessary and even essential, And community knowledge and representation of those disproportionately affected by these crises is critical. The challenge for us in the health sector is to engage and to help foster this collective action to address the very urgent population health crises that we are facing, grounded in the principles of spatial justice. On behalf of the Roundtable, thank you again to all who made this important workshop so meaningful. Be well.